This is Crystal Phend with MedPage Today, here in Chicago at the Society of Interventional Radiology meeting, where researchers have reported on the use of microscopic radiation pellets to treat liver metastases. Dr. Riad Salem of Northwestern University presented the results at a press conference here.
The device that was used for this therapy is called Microsphere. This is a microscopic glass particle that is embedded with yttrium, which is a beta emitter that emits radiation therapy. The concept is that as interventional radiologists, we can advance catheters into liver tumors and inject these radioactive pellets to deliver a very high dose into the tumors in a very focal manner. So the theory here is that we can get very high dose, very locally inside the tumor with very few systemic side effects.
The researchers conducted a single-arm, open-label trial with the treatment in metastatic liver cancer progressing on systemic therapies.
This therapy, Microsphere, demonstrated excellent tolerability and safety. This was the initial intent of this trial, to show that we can do this in multiple centers. We are able to reliably deliver a high dose of radiotherapy directly and focally inside the liver tumor. And really, it is a prospective confirmation that we can perform multi-center trials with this kind of therapy in patients with very advanced disease, and that the results were very reproducible among all of these centers. The study really set the stage for us as investigators and cooperative groups and manufacturers to devise and work on multi-center international randomized phase 3 studies. So the most common adverse event this therapy causes tends to be fatigue and some nausea and some vomiting. But fatigue by far dominates the symptoms that people that are getting focal radiation get, and so that's about 50 to 60% fatigue. The very interesting concept that this new therapy shows is that we can do these sort of very high-level, very potent therapies on an outpatient basis. All of these patients in these trials are done on an outpatient basis. They come in the morning and they're gone in the early afternoon. So really a change in paradigm of cancer therapy. Rather than getting sort of long infusions, etc., you come in, you get treated, and you go home on the same day. So really the chance and the ability to change standards of care and the way things are done from a quality of life standpoint as well.
So the investigational targeted radiation treatment appears promising for liver metastases but needs further study. Here at the SAR meeting in Chicago, I'm Crystal Phend, MedPage Today.